The COVID-19 pandemic continues as we continue into the holiday season. On this episode, hear the latest on disease transmission and the importance of getting vaccinated.
Whether you live in or just love Johnson County, Kansas, JoCo on the Go has everything Johnson County. Here's what's happening and what's coming up in the community you call home.
Thanks for joining us for JoCo on the Go. I'm your host, Teresa Frieda, Johnson County resident and employee of Johnson County government. Although we haven't been talking about the pandemic lately on the podcast, make no mistake, plenty of work has been happening to stop the spread of COVID-19 in Johnson County. Here with an update on disease transmission and safety precautions is Johnson County Department of Health and Environment Director, Dr. Sami Ariola. Thanks for being here.
Thank you, Teresa. Thanks for having me.
All right. Well, first off, big question is just what are we seeing in terms of what's happening with COVID-19 in Johnson County?
The key thing for our residents to be aware of is that the activity is very high in the county right now. And those are easily seen in our numbers. If you look at the dashboard, there are two key metrics that we talk about all the time. One is incidence rate. Just a few weeks ago, as recent as 4 weeks ago, the number was around 90, slightly under 90 per 100,000 residents. Right now, the number is at 340 per 100,000 residents. Positivity rate is at 11%. At that same period, it was around 5%, even dropping below 5%. So again, when you keep in mind that we're not catching all of the infections, the numbers that we're providing to you, especially the incidence rate, are the cases that we know about. There are people that choose to get tested. Testing numbers have been down also. Again, so if you really have a robot testing and you're catching all of the numbers, what we are presenting to you, at least for incidence rate, will be higher. It does again underscore that the virus is here, still actually driven by the Delta variant here, and underscores the need for our residents to continue to be very careful and take important steps to protect themselves. And those steps we've talked about, none right now is bigger than getting vaccinated, getting your booster shots. We know that boosts your immune response and protects you against the Delta variant. But you also have heard about the Omicron variant, which is a variant of concern. Data that's coming out from other parts of the world is showing that with the booster shots, the ability of that variant to circumvent immune response is greatly reduced. Get your booster shots, wear masks, all of those messages are very important right now.
So another important question is to what are we attributing the recent increase in cases? Is that associated with the previous holiday or something else?
Typically, increases are a function of several factors. The fact that we have a variant that's circulating that's highly infectious, the holidays, every time that you have more people gather together. We had Thanksgiving right after other celebrations, and people got together, and rightly so. This has been going on for a long time, and because we have more tools now, especially the getting people vaccinated. If you do that the right way, where you are gathering together with others that are vaccinated, wearing masks as appropriate, avoiding crowded indoor environments, those are good things. But yes, all of those, the more people gather together, and if you walk around the cities here, you see that compliance with the wearing mask is not very high. So all of those are contributing factors. And again, to be clear, when Omicron become more widespread here, if it turns out that what we currently know holds true in terms of being more infectious than Delta, all of those factors become even more important for our residents to take into consideration.
And so the cases that we are seeing, are these predominantly people who are not vaccinated, or are some of these breakthrough cases of people who've been vaccinated and maybe even also received boosters?
A lot of the cases are driven by those that are unvaccinated. I check with hospitals on a regular basis, and the picture is very clear. A lot of those that are hospitalized, that are in ICUs, are actually unvaccinated. Yeah, we do have some breakthrough infections, but when you're vaccinated, the risk of more serious consequences are very low. And when you have a high level of vaccination, as we do, even when the percentage of breakthrough infections are low, it will appear that it is a lot more than it is. So yeah, we do. This is driven largely by those that are unvaccinated. Again, the recommendation remains the same, that even for those of us that are vaccinated, we need to get our booster shots. It provides an even greater level of risk of protection, and wear masks as often as you can, especially in the indoor environment. For those that are not vaccinated yet, we continue to urge you to get vaccinated. We're making progress vaccinating our 5 to 11-year-olds right now. And we are doing a lot more to make sure that we get the vaccines into their arms, which is why we have added a few events coming in the next couple of weeks. On December 21 and December 28, we're going to open up vaccine clinics. That's in addition to our regular Monday through Thursday clinic. And this will be for 5 to 11-year-olds. The hours will be from 8 a.m. to 11:30 a.m. at our Sunset Drive office building, and that's on 11811 South Sunset Drive in Olathe here. The zip code is 66061. Between those hours, 8 a.m. and 11:30 a.m., you can bring your child in. You don't need an appointment. There's a form that you can fill that will make your appointment quicker, but you do not need an appointment. You can come in, and if you are not able to make those 2 dates, on those days, we still have regular Tuesday clinics from 1 to 7 p.m. at the Northeast office in Mission. And so we're continuing to just provide additional opportunities for children to get vaccinated, be protected, and be in school as safe as they possibly can be.
And we're seeing, some trends in schools lately where kids are getting COVID. They might also, have flu or, other things that are happening too. But that really does interrupt the school session. And I know we'll be on break here shortly. But what message do you have for parents about the safety of the vaccine if they're considering, they're on the fence, maybe they're waiting to see if there's more information available at some point?
The vaccines have been tested before they came into the market. But I'll tell you what's even more convincing is that we've given hundreds of millions of these vaccines across the world. And the safety and the efficacy continued to be proven. And so I don't have a recollection of giving this many shots across the world in such a short period of time, providing just a rich library of data that we were able to look into and confirm efficacy and safety. But I continue to tell people, look, you take your child to your pediatrician anyway for the other vaccines. If you have questions, it is okay to have questions. It is normal to have questions. I think by far the best thing though is to make sure that we are seeking answers to those questions from reputable sources, from our doctors who we have trusted with the care of our child for several years. Even before they were born, we were going to the doctors. And so those are the people that we need to direct our questions to. And they will advise you appropriately, answer your questions. And the reason that's important is it's tough as a private citizen to sift through the horde of misinformation that's out there, reasonings that may appear to be to make sense when in reality it does not reflect what we know in terms of the science and data from the safety and efficacy of the vaccines.
All right, I know a lot of parents, you know, are carefully weighing the information that they're getting and talking to their parents about their experiences and things like that. And so those sorts of discussions, you of course encourage, but we want to refer people back to those official sources, like you said. So Johnson County Department of Health and Environment, the Kansas Department of Health and Environment, CDC and FDA, those are all really good sources. And they do tons of research on these. So I think, you know, it's important for people to know where to go to get that great information. I think another important thing for parents to know who are considering getting their children vaccinated is just how accommodating, like, for example, the health department is in making sure the kids are comfortable, they're reassured in getting their shots. And so I think that might be something else to share, even with the upcoming vaccine clinic. This is not a mass vaccine clinic where kids are going to be, you know, shuffled through to get poked in the arm and then, you know, rushed off. This is a situation where if people need a little extra time, you know, to help their kids feel comfortable, then that's also being done. Is that right?
And I think that's thank you. That's an excellent point to bring up. Is our nurses here have been given these shots. It's what they do every day to younger residents. They know how to handle them. They give them the appropriate time and attention that they need. You know, some children come in, get the shot, go away. Others require a little bit more attention. We are prepared for that. It is our nurses are trained and highly experienced in dealing with all of these variables there. So no, it's not like the mass vaccination clinic for adults where we were giving out thousands every day. That's not, this is designed to provide the attention needed for each of the kids to make them comfortable and get them vaccinated. And so, yeah, that's a very good point to stress that just like when you go to your doctor's office, you get the attention. That's very similar. Sometimes we need to take the children to a place where they can relax. We have all those as part of the plans to ensure that it's a good experience for the children as much as possible.
And I think another important point is, you know, we continue into the school year. Nobody wants to have to send their kids to school in a mask, and you know, it's tough for people to manage that physical distancing as well. But the goal that we all have is to get to a point where we don't have to do that, and really, we're going to get there only if we follow the safety precautions now and get everybody vaccinated. Is that right?
Our goal continues to be to return to life as we knew it, as normal as we possibly can. I put on mask. I don't necessarily like wearing mask. I love to be able to talk and to be free, but we sometimes we have to do the right thing. These are unusual times. We've got a virus that's circulating, and I am acknowledging the discomfort that comes from that. A school environment, though, I would again emphasize that because of the mitigation processes that we have in place, especially wearing masks, we have been able to keep our children in school. We were able to do that last year. We've been able to do that this year in person because we quickly identify cases through testing. And I really do commend the schools for the efforts to do case investigation and contact tracing. I commend them for the efforts to encourage wearing masks. I commend them for the test to stay program. Again, testing is a very critical piece of this that allows us to, again, quickly identify cases and take steps so that the virus is not spreading. The school environment is very conducive for the spread of the virus. So you could have 1 or 2 infections easily become a larger outbreak if you don't take those steps. So again, to keep our schools safe, to keep our children healthy and learning in the right environment, wearing masks, in addition to other mitigation measures, are very, very important.
And we do want to mention too, in addition to the 5 to 11-year-old age group now being eligible for vaccines, we recently got news that those older teens also are now eligible for their booster shot. So when should they be doing that?
It's excellent move by the Food and Drug Administration, as well as the Centers for Disease Control and Prevention, to quickly ensure that booster shots are available for 16 and 17-year-olds. For those that, anybody below the age of 18 is receiving the Pfizer BioNTech vaccine. Again, we are seeing from data and research that the booster shot does increase your immune response and protect you better. And so the prompt approval by CDC allowed us to begin to offer booster shots since Monday, the 13th of December. So if you are 16 and 17-year-olds, this is your opportunity. Book an appointment, get vaccinated. We have clinics open throughout the week. The appointment, you can always go to our website to book an appointment. We have an afternoon appointment if morning hours are not convenient, especially during this holiday time when children are not in school. We're also working with at least one school district, Shawnee Mission School District, that is organizing several vaccination events. And so lots of opportunities to get your booster shots. Again, keep in mind that you have other providers in the county. You've got the pharmacists giving shots. You've got pediatricians giving shots. You have family practice offices giving shots. So it's a lot different than where we were in January. A lot more providers, a lot more places for you to get vaccinated.
Great. So there's plenty of vaccine to go around. So all you have to do is make an appointment, and there's lots of places where you can make those appointments, and be sure to get your first dose, your second dose, and that booster dose timed just right. The provider will, of course, tell you when you're due back for your next one, I'm sure.
Yes, and I'll tell you, Teresa, that the response that we're seeing, people are getting their booster shots. They're coming in, they are filling up their appointments, and we're seeing the gradual increase in the numbers. And that's also true for our 5 to 11-year-olds. Last time I checked, we're closer to 30% vaccination in that age group. And we had programs of vaccination since last week, and including some by our partners where the demand has really been very good. So that's good to continue to see that, to continue to get the vaccine into the arms of as many residents as possible. And the more residents we get protected, the better we are in fighting infections, the better we are in preventing more serious outcomes. And obviously, the better we are in fighting the opportunity for the virus to mutate and other variants to come that could be more dangerous. So.
All right, great information. And of course, our listeners can get more information about COVID-19 in Johnson County by going to jocogov.org/coronavirus. Well, thank you again for being with us here today. And we look forward to continued updates as the pandemic continues and hopefully winds down. Thanks for listening.
You just heard JoCo on the Go. Join us next time for more Everything Johnson County. Have a topic you want to discuss? We want to hear from you. Follow us on Facebook and Twitter at JoCoGov. For more on this podcast, visit jocogov.org/podcast. Thanks for listening.